CDC data shows many pregnant women are still reluctant to get vaccinated, even though they're more likely to get very sick or even have childbirth issues if they do get COVID. Fox 12's Audrey Wheel is taking a look at the latest advice from doctors for pregnant women amid the Omicron surge. Audrey?
Nora, the doctor I spoke with at OHSU says that they have seen more pregnant patients with COVID as cases increase, and she is just as concerned now about pregnant women getting COVID as she has been throughout the pandemic.
As the physician that cares for you during your pregnancy, I care very much that you and your baby have a good outcome.
Dr. Amy Hermish at OHSU says it's heartbreaking to see expecting mothers sick with COVID-19, which can cause serious issues for them and their baby.
Pregnant women who do contract COVID-19, especially those who are unvaccinated, are at higher risk of developing severe disease, higher risk of being admitted to the ICU, needing support like ECMO, and they're at a 70% increased risk of death.
She says even though the Omicron variant does tend to cause a little bit milder disease than previous COVID variants, it can still cause severe illness, including in pregnant women.
Every patient that I see, I encourage them to get the COVID vaccine because it is, based on the data we have available, which is a lot of data, it is safe and it does reduce the risk of getting COVID, and it reduces the risk of when you do have it, you don't get it sick. And that's better for you and better for the baby.
But according to CDC data, pregnant women in the U.S. are still more vaccine hesitant than the general public, with just over 40% of pregnant people 18 to 49 fully vaccinated against COVID, compared to more than 70% of all people 18 and up fully vaccinated.
I think there's a lot of misinformation out there, both on social media forums and anecdotal stories from people. So really, I think it's hard when you hear a lot of different information. I would encourage women to really just to trust their healthcare providers.
And Dr. Hermish says anyone who's pregnant right now should not only get vaccinated and get a booster shot, but also avoid any sort of high-risk situations like large gatherings where people aren't wearing masks. Reporting live in Northwest Portland, Audrey Wheel, Fox 12 Oregon.